Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual, and today we will be discussing some more important clinical care tips and rules. Rule number 194. Treat the fever when it bothers the child, not when it bothers you. So those of you who know me or have listened to my podcast before can probably imagine I can go and speak about this rule all day. I think we in the United States 2024 have an obsession to do something or treat the patient somehow, when in fact most kids really don't need a whole lot. Fever is a great example. So going back to medical school and basic immunology, we all know that fever is part of the innate immunity. Innate immune response is part of the immune response. It's a very important part of the immune response, and it's essentially all we can do when the child has a viral illness. We all know there's really no effective medication for any of those viruses, with the exception of Tamiflu, which I can also argue is not particularly effective. There's really no medication that you can give the child to take away the virus. And the immune system is all we can do. And again, fever is part of the immune system. So why be so obsessive about treating it? I can't tell you how many times I walk into a room and there's a screaming toddler whose nurse is trying to shove Tylenol or Motrin down his mouth. He or she clearly don't want it. They're crying, they're screaming, they're spitting it out. So what's the point of treating the fever if the fever is part of the immune system? And several studies, specifically with influenza, have documented and concluded that treating the fever just prolongs the viral illness because essentially we're taking the immune response away. Now, for many kids, I would even say maybe even most kids, fever can really make you feel terrible. And those of us who have had fever as adults can certainly testify to that. It gives you muscle pain, headache, and just overall bad general feeling. Certainly, some kids, that will make them cry, fuss, not drink, not sleep, etc. That's certainly not something that I want, and in those circumstances, I certainly recommend treating the fever. However, there's a subset of kids, and one of my 3 children happens to be one of them, whose fever does not bother them. Those kids can be as high as 103, 104, and they're happy, smiling, and comfortable. Under those circumstances, I see no reason to treat the fever. Fever is there, it's there for a reason, it's part of the immune system, and it helps the body fight the infection. And if the child is comfortable with it, taking the bottle, having fluids, not having difficulty breathing or any sort of discomfort, why treating it just because? This is something I tell the parents all the time. Treat the fever when it bothers your child, not when it bothers you. If the child is happy with the fever, let he or she have it. The longer they have fever for, the sooner they'll get better. It is as simple as that, and many studies, specifically with influenza, have documented exactly that. So remember rule number 194 as a clinician. Treat the fever when it bothers the child, not when it bothers you. Rule number 195. Ignore the triage level. Sometimes. First, I'd like to thank Jaron Smith, the Pediatric Emergency Medicine now attending, whose ideas and rules have been on the podcast before. And Jaron texted me a few months ago with this rule, which I think is actually something very important to think about. So triage in emergency medicine is actually a very important component of what we do. It allows us to segregate our patients to sick, moderately sick, not sick, etc. But no matter which triage system you use, it is never perfect. So every once in a while, in fast track or even in the urgent care, a patient ends up being a lot sicker than what we thought, and that often generates a lot of anxiety and some maybe bad outcome. So I think it's very important for us physicians, when we see the patient, to think about the triage level and the setting we're at, but sometimes it might as well be a good idea to ignore it. In the words of Jaron Smith, who texted me, triage levels are useful only for deciding which patients need to be seen first. Once the patient is placed in a room, however, the clinician is wise to ignore the triage level and do their own independent assessment. Jaron, I couldn't agree more. Jaron continues in saying, avoid anchoring to the possibly incorrect triage assessment. A healthy dose of skepticism about the assigned triage level is appropriate. Jaren, I couldn't agree more. Again, easier said than done, especially in a routine, long shift towards the end, but you will be very wise to do that with each and every one of your patients. Yes, let the triage nurse do what they do best. However, when you go into the room, sort of ignore it, do your own assessment, and realize maybe this patient, this child, is sicker than what the nurse thought. A good idea and a good dose of skepticism is always appropriate. Thank you, Jaren, for this rule. Rule number 196. When studying and teaching medicine, make it stick. So I can't possibly explain this rule in a better way than referring you to the Facebook page for PEM Rules, where I posted some audio-visual aids for learning. I'm a very big fan of audio-visual tools when learning and learning medicine and whatever it is you're learning, simply because they're very helpful and nowadays they are easy to access. You can always watch a YouTube video, you can always see pictures online, and many times, especially in medicine, pictures go a long way. We can all read and learn about small bowel obstruction and what the air fluid levels of an X-ray mean, but a picture showing what air fluid levels really mean, like the one I have on my Facebook page, can really go a long way and make that information stick. This is especially true for medical students at the beginning of their career. Another good example is the hyperkalemia video, which is super low tech and now super old, but something that has helped many of my pediatric, emergency medicine, family medicine residents, and some of my students really help understand and remember the side effects or EKG changes of hyperkalemia. Something that is very important for us emergency medicine physicians to recognize, and something that without an audio-visual aid is just harder to grasp. I encourage you to check the video and some other audiovisual aids I have on my Facebook page, simply to make medicine stick. The information we learn without seeing patients can sometimes be very difficult to learn and understand, and a picture or a video really go a long way. So when studying and teaching medicine, make it stick. Find your audiovisual aid that can help your learner or yourself learn it, understand it, and remember it in the long run. Of course, as I've said before in the past, and it's one of my rules, to become a good physician, you got to see a lot of patients. There's no better way to learn medicine than seeing the actual real patient in front of you. But when learning medicine, I think audiovisual aids to make it stick can really go a long way. And that is it for today, guys. Thank you very much for listening to PEM Rules. I appreciate. Again, check out the Facebook page for many pictures and videos that I think can help you with your learning of pediatric emergency medicine and beyond. Let's briefly review what we learned. Rule number 194. Treat the fever when it bothers your child, not when it bothers you. Fever, as we all know, is part of the innate immune response. It doesn't fry the brain. We're not even sure it's the reason behind febrile seizures. It's simply there to fight the infection. And if the child is not bothered by it, maybe it's just better to leave the child alone. Rule number 195, in the words of Jaren Smith, ignore the triage level. Sometimes, when you go into the room of a level 4 or even a level 5 low acuity patient, have your own assessment and be aware no system is 100% safe, and sometimes what is triaged as low acuity can actually be something serious. A low dose of skepticism can go a long way. Rule number 196, when studying and teaching, make it stick. Learn some audio-visual aids, look for those and show them to your residents and your student. Use them yourself because sometimes a picture or a video can really go a long way, more than just reading a book, reading an article, etc. In today's world, when technology is so available, that is easy to do and highly recommended. Thank you again for listening to PEM Rules, for checking the website and for contacting me. Thank you, Jaren, for contacting me again, and thank you for your wisdom. Please check out the Facebook page and continue to be in touch. There's also a new PEM Rules store where you can buy some merchandise, some fun stuff for yourself, or as a gift for some of your colleagues. The following outro is a song that I think is originally by Neil Young, who I'm not particularly familiar with. I like to play it with the Pearl Jam version that Neil Young and Pearl Jam did somewhere in the 90s, back when there was MTV Music Awards. Hope you like it. Have a great day.